Okay. Well, I have the task of introducing Dr. Lisa Wolfe and summarizing her career over 20 years in about 3 minutes, so wish me luck. Over the last 20 years, Lisa Wolfe has built one of the most comprehensive programs for ALS respiratory failure in the country at the Lois and Soil Clinic and in partnership with the Les Turner ALS Center. Early in her career, she understood that timely respiratory intervention in ALS would not only improve quality of life, but that it was also proven to extend life in people living with ALS. Lisa has published over 50 papers with a focus on respiratory support in ALS, and she is one of the most recognized physicians in the world in the treatment of respiratory care for neuromuscular disease. She has helped to develop both national and international guidelines for respiratory care in ALS. In addition, she has worked with multiple international respiratory societies to make sure that the next generation of pulmonary physicians have had opportunities for hands-on simulation and training for respiratory support in neuromuscular disease. Lisa understands that there's a national deficit in respiratory care providers for ALS, and it is her mission and her passion to share her knowledge with others so that all people living with ALS get the best possible respiratory support. Lisa is a pioneer in respiratory medicine for neuromuscular disease, and as all pioneers, her career has evolved, most recently into advocacy work. In the ever-changing landscape of healthcare in America, there continue to be hurdles preventing people with ALS from getting respiratory support. In the last 3 years, Lisa has made multiple trips to DC to speak in front of Congress as well as Medicare to focus on the care that people need. Now that I have summarized Lisa's 20-year career in about a minute and a half, my remaining time can be focused on what she really cares about, right? The patients. So I recently asked a bunch of Lisa's patients if they could think of one word that they would use to describe her, what would that word be? The responses were overwhelming, and not surprising, right? The words I heard were devoted, passionate, inventive. She's like the MacGyver of breathing. Caring, an ALS warrior, an advocate, my champion, dedicated, supportive. There was one patient and family where one word was just not enough. And so I'm going to quote what they actually said. Simply put, my husband would not be here without Dr. Wolfe. She has saved him in large and small ways over the years. Despite multiple ups and downs on this ALS journey, we were strengthened and comforted by Dr. Wolfe's presence and unyielding spirit. Even in our darkest moments, where I just didn't think I could handle these new challenges, when I doubted that I could be the caregiver that I needed to be, Dr. Wolfe looked me right in the eye and said without hesitation, yes, you can. Dr. Wolfe has been the fiercest of generals on the ALS battlefield, and we will always gratefully and confidently follow where she leads. I don't think I can say much more than that, right? But I would like to finish up with a quote from the legendary great poet and philosopher, Miss Dolly Parton. If your actions create a legacy that inspires others to dream more, to learn more, to do more, become more, then you are an excellent leader. Ladies and gentlemen, it is my great pleasure to introduce my colleague, my mentor, my friend, this year's 2022 Award winner, Lisa Wolfe.
Wow. So Thank you very much for being here. Like everyone else has said, it is such a pleasure to be in person. John Coleman has been not just a partner and not just a friend. I think that most of you probably know that John has been a hero getting us through COVID in ways that pulmonologists have been front warriors, and I want to thank him for his help with us too. I just want to give you another sort of summary of a lot of the things that John Coleman was just talking about. The Lois and Solia Center, as part of the Les Turner Foundation, was established in 1977 because there was a desire to make sure that we did comprehensive wraparound care that looked at things like nutrition, occupational and physical therapy, speech therapy, etc. But in 1977, sadly, there was almost no discussion of support for respiration and breathing. It's kind of ironic because we had just gotten out of the polio epidemic, and at that time, we knew about iron lungs, but mechanical ventilators were huge. And realistically, there was no way to do respiratory therapy in the home. Our neurologists knew that respiratory complications were the most common cause of death in ALS, but really had no way to address it. It wasn't until 1990 that we had what we now refer to as non-invasive ventilation. And at that time, initially, it was only used in intensive care units. But by 1995, the devices had become smaller, more portable, they were easy to use, and they were available for home use. And so the Les Turner Foundation, and this is the story I've heard, is that in 1995, they sent Claire Owens and Eileen Mindell to the Cleveland Clinic to observe what could be done. And they came home and they told this to physicians like Rob Suffett and Scott Heller, who literally started writing on little squares of paper, "Give him a BiPAP machine." If you guys knew the complications that Dr. Coleman and I have right now, that would seem silly to you. But that's what they had, and that's what they did. And as Dr. Coleman said, to this day, we have very few trained pulmonologists who could really get our patients where they needed to be. So what did we have instead? We had our nurse advocates and our team from Les Turner Foundation. They taught patients how to avoid oxygen. They instructed the home care companies on what the needs were for patients with ALS. And by 1998, it became very clear to our then director, Wendy Abrams, that we needed a respiratory champion, a pulmonologist who could be committed to ALS and delivering complex medical respiratory care needs. But they had trouble finding a pulmonologist who could do it. But in 2000, Dr. Tipu Siddique noticed that a young pulmonologist trained in sleep medicine had been assigned to the Thursday morning clinic in neurology. ALS clinic is Thursday afternoons. So he came up to me and he said, "Hey, I think you can do this. I think that you're trained correctly. I want you to just go see one patient." And from that one patient, I now have a full career. But, of course, nothing ever flies straight. The next thing that happened was we couldn't get me officially into the clinic. So one day, Wendy Abrams was in Ohio for brunch, and she was seated next to a woman she didn't know, and she started to make friends with her. The woman is Bella Freeman, who's right over there. She's my mother. And Bella said to Wendy, "I think my daughter wants to take care of your ALS patients." And Wendy said, "That's interesting because I want her to take care of my ALS patients." She said, "What's the problem?" She said, "Well, the university and the rooms." And Wendy stood up and she said, "Those are my rooms." And when she got back, we had a full-time pulmonologist as part of the Les Turner and ALS Association. It has been my pleasure to take care of patients since then. We've learned things like it's not just about a BiPAP machine, it's about getting airway clearance so that we can prevent pneumonia in these patients. It's about being able to measure lung function in the office so that we have a good sense of the direction that our patients' care is going. But at that time, like I said, I did not have any mentorship. And so frequently there were things that passed our way without realizing it. One was that it was very important for ALS patients to have safe egress from the home and safety plans in case power went out. And one time we had a loss of a patient just because of a simple construction accident that took away power. As I was very devastated by this, it was suggested to me that I get on a conference call with a group from the American College of Chest Physicians. This group consisted of approximately 10, this is still the number today, 10 pulmonologists throughout the US and Canada who were dedicated to the care of patients with ALS. I met Doug McKim from Ottawa, who taught me the mechanics of the lungs in ALS. I met Dr. Peter Gay, who has been my inspiration for advocacy. And I have to say, we have been joined in our advocacy effort by Andrea Pauls-Backman, who has been a wonderful partner in our advocacy work. These techniques and therapies have made a significant issue or a difference over time. But I will say that for those of you who are patients, and John Coleman will agree to me, we have the best respiratory support system a pulmonologist could ever have. Where's Stephanie Hesser? There's Stephanie. Stephanie's background was as a medical assistant. And Stephanie has been so committed to our patients. She's learned how to perform lung function testing. She's calculated the needs that our patients need in terms of ventilation. She can read overnight oximetries. She even can use cloud apps now to monitor our patients and adjust their therapies, bringing the strongest support that we can possibly have. The other partner that I have in expanding technology is Dr. John Coleman, who you just got to hear from. John had strong training in pulmonary medicine before he came to us, but did not have a background in ALS. But he's a committed Chicagoan, and he's committed to home-based ventilation and has become a very important part of the Les Turner board. He also has worked on important work this year for the American Health Quality Research Council, for CMS, and is a member of the technical expert panel for both the American Thoracic Society and the American College of Chest Physicians, all of which I am very, very proud to call myself his partner. And then the next thing that I wanted to tell you about was the fact that our technology has expanded. We can do things now that we couldn't do in the past. We do have some partners here tonight, I believe, from ResMed, and they're somewhere in here, and they have been willing to fund our research in this area, allowing us to have new devices and new pathways. In addition, I'd like to say that I continue to have the dream of improving access to respiratory care for nationwide ALS patients wherever they live. And our dream continues to be that we will train fellows and have them follow in our path and be accessible to other teams. This year, we've added Justin Fiala and Colin Franz, who have done a significant amount of work in this area, and we're so happy to have them as partners. And as we continue to do the clinical trials in this area, I also want to thank Senda Driss, where's Senda? Out here? You know, Senda and I started together as fellows. Learning at the same time, committed to this cause of where we are. And Senda, I could not have asked for a better partner if I'd tried. And then lastly, I'd like to thank my friends who are here with me today. I have the Ohio girls, I have the Michigan A-Phi girls, and I have my family. Especially my husband, Brian, who's out there. For any family that has a 2 full-time working family and children, we know that supporting each other is the only way that we get through, and your support has meant everything to me all the way. And lastly, I'd like to say I have this watch on tonight. This watch was my father's, and he left it to me when he passed away. No, Stephanie, he did not leave it to me so that I could get to clinic faster. What he did want me to know is that, my father was, I guess I was 14 or 15 the first time he took me to the hospital. He showed me what hard work was. He showed me what it was like to take care of patients. He showed me what the reward was. And what I want to say is that it's the gift of time that I've been able to spend with all of you that's made all the difference in my life. So thank you very, very much for the award, and thank you for allowing me to share the time with you.